I've been asked, oh, recording in progress. Good to know. All right, welcome again, everyone. I've been asked to speak today about post-traumatic stress disorder and anxiety. So I'm just going to give a little overview of kind of what you can expect during the talk today. I'm actually going to start with stress, which is kind of a lower level before we get to anxiety and post-traumatic stress disorder. So we'll talk a little bit about stress, and then we'll go into anxiety, and then we'll talk about post-traumatic stress. Then I'd like to talk a little bit about coping during stressful times. We've all experienced about 2.5 years now of pandemic, so I think everybody knows what stressful times are like these days. Then I want to talk about when to seek help, how to seek help, and what to look for when you seek help. Specifically, I want to talk about some evidence-based treatments for PTSD. So let's start with stress. First thing to know is that we all experience stress. It's common to the human condition. And it is, in essence, an alarm system for your body. It is a way of telling your body that something is going on that maybe you need to attend to. You may have heard of a stress response that's known as the fight or flight response. And in recent years, they've added to that fight, flight, freeze, and a few other things. But in essence, if we think of it as fight or flight, the easy way to think of it, it's a system that gets your body ready to deal with major stress by giving you the energy to either fight against the stressor or flee from the stressor. So it's built into us. It's a human thing. It's good that we have it because it helps us to deal with stressful situations and to be able to fight or flee or what have you. And there's some common things that come up for all of us that often bring stress. So things like work can be stressful. We can have financial stress. Family relationships can be stressful. Health can be an area of stress. Change in itself can be quite stressful, just to name a few common areas of stress. And interestingly, stress is not all bad. It kind of gets a bad rap, but I mean, we can have positive events in our lives that are stressful. And I'm wondering if people can think of any just off the top of your head. What comes to your mind when you think of a positive event that was still stressful? Let's see if what you thought of matches with the picture I'm going to show you. Wedding, very common sort of positive event, wonderful, but very stressful in many ways. And this picture might show a little bit of the kinds of stress that you might experience planning for a wedding. So stress, when there's too much of it, can lead to things like increased worrying, anxiety, feelings of depression, symptoms like sleep difficulties. It can impact your relationships. It can have all kinds of impact in your life. And there's a range of responses that we may have to stress. On the low end, we're just kind of stressed out, and difficulties are transitory. You know, they're there for a little while, but we're not expecting them to stay. And so here's a little picture that might represent that sort of, you know, just having a bad day kind of feeling. On the other end of the spectrum is more longer lasting kinds of things. So maybe depression or anxiety or post-traumatic stress disorder, also known as PTSD. And so, you know, we can really fall anywhere on that spectrum. And a lot of it has to do with how severe the stressors are and how long we've been dealing with those stressors as to whether they just stick around and they're mild or they stick around for a really long time and they maybe start to reach the level where we might actually have a diagnosable condition like the ones on the right. So let's talk a little bit about anxiety. And I know I can't interact with you here today, but I would like you to take a minute, if you happen to have a pen and paper in front of you, and think about signs or symptoms that come to mind when you think of the word anxiety. So I'm just going to give you a minute. If you don't have pen and paper, just think through what things come up in your mind when you think of the word anxiety. And I wonder if you had any anxiety with the pressure of having to come up with answers. I did a presentation for a group of new recruits for the Winnipeg Fire Paramedic Service, where we talked to them about mental health issues that they may encounter themselves or among their colleagues or among patients that they are dealing with on the streets of Winnipeg. And we gave them, after we taught them a whole bunch about anxiety, we gave them a task where they had 3 minutes and they had to come up with words that represent anxiety from A to Z through the whole alphabet. And so there's pressure. 3 minutes to come up with a word for anxiety for every letter of the alphabet. A little tricky. Anyway, let's see what you came up with and how it compares to the list that I have here, which is not the entire list, of course, because I don't have all A to Z, but one of the things that often is associated with anxiety is excessive worrying. Another thing is difficulty sleeping. Feelings of restlessness, kind of having difficulty sitting still. Fatigue often accompanies anxiety. It's exhausting to be anxious all the time. It also impairs your concentration. And it may lead you to feel quite irritable, have a lot of tension in your body. Physical signs might be things like an increased heart rate or palpitations of the heart. You might experience sweating or hot flashes when you're anxious. You might tremble and shake when you're anxious. Some people have chest pains and shortness of breath. And some people have feelings of terror or impending doom. So a lot of these words are things that come up for anxiety, and you may have thought of all kinds of different ones as well. There's a whole bunch of things that are related to anxiety. And I just wanted to sort of draw your attention to these ideas, partly because we're going to move into talking about PTSD now. And there's an awful lot of overlap with PTSD and anxiety. In fact, PTSD at one time was listed as an anxiety disorder in, I don't know if you can see me or not, but in this book called The Diagnostic and Statistical Manual of Mental Disorders, which is what mental health professionals use to diagnose various disorders. And the version 4, the one prior to this one, which is 5, had PTSD listed as an anxiety disorder. But when they came along with the 5th version, they decided that PTSD and other trauma-related issues should actually be a category of their own. But as we start talking more about PTSD, see if you notice whether these symptoms that I've listed or any of the ones that you've listed actually come up as symptoms of PTSD. So the next thing I want to do is show you a slide that talks about the overlap between PTSD and other mental health difficulties that people have. It's a slide that I borrowed, and so I can't change the title of it. So it's a bit of a fancy title, Psychiatric Comorbidity in the over a lifetime. So comorbidity just means that things are occurring at the same time. And so what this is showing you is that PTSD has an awful lot of overlap with a whole bunch of other mental health concerns. So you'll see major depression is kind of the biggest one at 48.2% overlap. Alcohol abuse and dependence at 39.9%. But then if you look at all 4 of the other circles, those are all anxiety disorders. Panic, GAD is generalized anxiety disorder, agoraphobia is a type of anxiety disorder, and then social phobia is another one. So in fact, there was a study called the National Comorbidity Study, and it indicated that 79% of women and 88% of men who had PTSD also met the criteria for at least one other disorder during their lifetime. So PTSD overlaps with all kinds of things, and anxiety symptoms in particular. So I'd like to show you a little video now about PTSD, and this comes out of the Veterans Affairs Organization in the United States, and they have done all kinds of work on PTSD. They have a large population of military and veterans who they can study to learn about PTSD, because unfortunately serving in the military and going into combat zones, for example, rather frequently leads to the development of PTSD. So sadly, they have a lot of opportunity to study what impact PTSD has on people, but that also means that they're an excellent resource for information about PTSD and PTSD treatments. So I'm going to show you a short little video here that they put out about PTSD.
Have you or someone you love ever been in a tornado or car accident, experienced sexual or physical abuse, served in a war zone? Most people have been through some kind of life-threatening or traumatic event, and it's common to have stress-related reactions after a trauma. But when symptoms last more than 3 months and they're not getting better, it's time to get help. Meet Sam. He recently returned from serving in Iraq. For many people, being in a crowded place like a baseball stadium or busy grocery store feels comfortable, but not for Sam. What should be a nice night out, taking his wife Tara to a restaurant, isn't fun for him anymore. He can only handle it if he sits with his back to the wall where he has a good view of the exits, and even then, he's too on edge to really enjoy it. At home, things aren't the way they used to be either. His sleep is restless at best, and some nights Tara isn't sure if Sam comes to bed at all. Sam seems to have a short fuse these days, and sometimes he snaps at Tara over tiny misunderstandings. What he and Tara never talk about is the trauma he experienced when he was deployed. He's never mentioned the guilt, the weight he carries around, wishing he could have done more to prevent what happened. Instead, he's turned inward, pulling away from family and friends. Tara tried to give him some space, but after months passing without change, she really started to worry. She was the one to finally say what they were both thinking: it's time to get help. That's when Sam finally decided to take action. He reached out to a doctor who told him about PTSD, or post-traumatic stress disorder. Sam's symptoms were getting in the way of enjoying his life. Re-experiencing, hyperarousal, feeling worse about yourself or the world, and avoidance are the 4 types of symptoms people with PTSD have. Sam's doctor explained each. The first is reliving the event, or re-experiencing. This is often an unwanted memory or even a flashback where you feel like you're right back in the situation again. Seeing, hearing, or even smelling something that reminds you of the trauma can trigger these. Nightmares where you relive parts of the event in your sleep are common too. The second is avoidance, staying away from situations that remind you of the trauma. That's why Sam tries to avoid thinking about painful memories altogether. He pours himself into his work or uses alcohol to keep his mind from going back to the trauma. The third is feeling worse about yourself or the world since the trauma. You might feel overwhelming guilt like Sam, or not trust anyone. You just might not be able to feel happy, even when you are around people you love. The fourth type of symptom is sudden rushes of anger, irritability, feeling jittery, always on alert, always on the lookout for danger. This is called hyperarousal, and loud noises or a driver cutting in front of you can be all it takes to set you off. If you recognize any of these symptoms of PTSD in yourself or someone you love, don't wait. See your doctor to find out if it could be PTSD. Just like Sam and Tara found, there is hope. You don't have to live with the symptoms of PTSD forever. Effective treatments are available. To learn more about PTSD or how to get help, visit the National Center for PTSD website at www.ptsd.va.gov.
Okay. So I wonder if any of the various anxiety symptoms that you thought of in that exercise where I asked you to think about anxiety symptoms came up in this video for PTSD, and whether you can see some of the overlap. I'm going to talk now about the prevalence of traumatic experience versus PTSD. And you may or may not have picked up at the beginning of the video that we just watched, the narrator said something along the lines of just about everybody or most people experience a traumatic incident in their lifetime. And that's really important to know that experiencing trauma is unfortunately quite common. Now, when the narrator said whether it was most people or just about everybody, that might be a little on the high side, but here's a study from 1995, the National Comorbidity Study, which I referenced earlier, in which they found that 61% of men and 51% of women, so more than half, experienced at least one significant traumatic event in their lifetime. Now, of course, it all depends on what you categorize as a traumatic event, but something that would kind of meet the criteria to potentially have someone diagnosed with PTSD would be what they were looking at in this study. Another thing to know is how prevalent it is. So this is from the United States, and I'll talk about Canada in a minute. But again, we tend to have more research out of the United States just because they're so much bigger than us. So this looked at lifetime prevalence of PTSD in the general population, and they found that overall it was between 7 and 9%. And when you break it down between men and women, it's about half the amount in men as in women. Statistics Canada in 2021 did some study of this phenomenon and found about 8% of adults met criteria for probable PTSD. So that fits with what we saw in the United States, between 7 and 9%. We're right in the middle there at 8%. And they also noted that about 5% actually had a formal diagnosis of PTSD, whereas the larger group, 8%, looked like they probably had PTSD based on how they responded to some questionnaires, but they hadn't necessarily all been diagnosed with it. So how do we diagnose PTSD? Well, as the video talked about, there's certain symptoms, and these are the 4 groups of symptoms that were discussed. But of course, before we even talk about the symptoms, you have to have experienced a traumatic incident. If you have all of these symptoms, but there was no traumatic incident, then you're experiencing these symptoms for a different reason, not because of a trauma. But if you have experienced a traumatic incident, which meets certain criteria, for example, unfortunately, losing your beloved cat is not considered a traumatic experience that would kind of make it to the DSM to be diagnosed with PTSD. But many other traumas would be. So then once you have that, then we look at, do you have these various types of symptoms? So are you having this re-experiencing where reminders of the traumatic incident keep coming back into your mind, whether it's memories popping into your mind while you're awake, or dreams or nightmares about the incident while you're asleep, or just being kind of set off in terms of having negative moods or uncomfortable feelings in your body when something reminds you of the traumatic experience. The second category is avoidance, and this involves 2 different types of avoidance. You can be avoiding sort of internal things like your own thoughts and feelings about the trauma, or you could also be avoiding situations that remind you of the trauma. So maybe it's certain people, certain places, that sort of thing, certain discussion topics. High levels of arousal, or hyperarousal is the term they used in the video. So being really on edge, jumpy, irritable, kind of looking out for danger. And then the last category is negative thoughts and moods. So, you know, a real change in how you've been thinking, so that it's really taken a downturn and you're feeling bad about yourself or other people or the world. Yeah, so let's move on to the next slide, which is what can you do for yourself during times of high stress? Okay, so we talked a little bit about, you know, some of the symptoms of PTSD, and hopefully nobody out there is experiencing that, but quite likely a lot of you are experiencing high stress. As I mentioned, COVID has been a very high stress time for many people, and it hasn't completely settled down yet for many folks. But there's just sort of natural times of high stress. There were, you know, the wedding, for example, when there's a new child in your family, when there's a new job, pressures of all kinds during life can be periods of high stress. So before we get to the level of, oh my goodness, you have a disorder and maybe it's PTSD and maybe you need to seek professional help, let's just think about what can you do yourself when things are pretty stressful for you. So the first thing is to recognize what's happening. Just be aware. Notice that, gee, there is a lot of stress in my life right now, and maybe I'm acting a little differently or feeling a little differently. Talk to friends, to family, or any other supports that you have. Talking is always such a good way to manage stress. Use creative problem solving. Sit down with a pen and paper and see what you can come up with if you brainstorm all kinds of ideas to potentially solve some of the issues that you're dealing with. Do your best to keep your sense of humor. It can be a real good coping strategy when you're able to laugh a little. Writing about what you're experiencing can also be very helpful. So, you know, journaling about what's going on, for example, is a way to get it out. Talking is one way, but writing is another really excellent way. Whether talking or writing, you're getting things out of your head so that they don't just keep spinning around in your head and tormenting you. There's something about getting it out there somehow, whether it's through speaking or writing or some other art, for example. Some people can use art, all kinds of different ways, but get it out of you somehow. And the last one is accept that you, like all other human beings, have limitations. So that means you may not be able to do everything that you can do in your best times when you're feeling a period of high stress. And maybe you need to lower your expectations for a little while. Get some help, for example, even if it's help around the house or what have you. The next slide is, what can you do for someone else who appears stressed? So let's say you've got, you know, a family member or a friend, and you're noticing that they don't seem to quite be themselves. What can you do to help them? Well, first of all, check in with them. You know, don't just ignore it. Ask them how they're doing. When you do that, mention your specific concerns, but not diagnoses. So what I'm getting at here is, you know, ask a question like, how are you doing? It seems like you've been kind of stressed lately. Don't say, oh my goodness, I think you might have PTSD. Okay, leave that to the professionals. And you don't want to add extra worry by telling somebody, oh my goodness, you might have this diagnosis that's kind of scary. You could provide information on how to access services if you happen to have it. And I will go through a few things in this presentation today about some places to access services. And follow up with them. Don't just check in the once. Come back the next day or a few days later and see how they're doing now. The next is when to seek help. Okay, so as you can see from the picture on the screen, we have sort of a balance here, a scale where there's a bit of a balance between stresses and coping skills. And so it's meant to sort of make you think about the idea that, well, maybe when the stresses are outweighing the coping skills, that's when you need to seek help in a general sense. But let's talk about some other times or ideas about when to seek help. So when should you access some additional resources beyond and above, just family and friends and other supports? Well, maybe you need some more information about what's going on. So reaching out to an organization like ADAM, for example, would be a great way to get more information. You might also be looking for some additional resources when you notice that things are getting increasingly difficult for you to handle. If you're starting to have the feeling that you're at the end of your rope, so there's a little picture to represent what that might feel like. If changes that you're noticing in yourself seem to be more long-lasting rather than just short-term. So it just hasn't been a bad day or two. It's been going on for weeks or months maybe. Another thing is if those feelings and behaviors start to increase over time, you're getting even more of these feelings that you wish you didn't have, or doing things that are different for you, like avoiding friends and family, that sort of thing. If the feelings and behaviors are interfering with your day-to-day functioning, so for example, if you can't get yourself out of bed in the morning, that's a good time to reach out for some additional help. If you're finding you're overusing alcohol or medications or drugs. And definitely anytime you're having thoughts of suicide or unremitting thoughts about just things being hopeless, definitely seek help. So how do you get additional help? Well, here's some of the things you could do. Often a very good starting point is your family physician. You can talk to your family physician and they can often give you a referral to some kind of a mental health professional if that seems to be what you need. So mental health professionals could include psychologists like myself, psychiatrists who, for those of you who don't know the difference, psychiatrists have a medical degree and they often are involved in prescribing medications to help with mental health issues. So they have a medical degree that specializes in mental health issues and they can prescribe meds. Psychologists do not prescribe meds, at least not in Manitoba. And we tend to focus more on talk therapies. And there's a wide range of other mental health clinicians, such as social workers and psychiatric nurses and so forth, and all can be found within the public health system. One of the problems is that the public health system is sometimes quite bogged down and there are long wait lists. So that's unfortunate, and we all need to do something about that if we can in terms of how we vote or what have you. But anyway, here are other alternatives. If you're stuck with a long waiting list, you could go to the Manitoba Psychological Society. They have a referral directory on their website, which is mps.ca. Now, unfortunately, psychologists that aren't in the public health system, you have to pay. It's a fee for service. However, many people have some sort of extended health benefits through their insurance that would cover a handful of sessions with a psychologist. So that's another place you can go. Many people have employee assistance programs through their places of work. So that's another great place to reach out for help. And then, of course, we have peer support organizations. So the Canadian Mental Health Association, or ADAM, is another great one. All wonderful places to reach out for help. So now let's talk about when you seek out help, what should you be looking for? And one of the big things with PTSD is to seek out evidence-based psychotherapies for PTSD. So you want to make sure that the treatments that you are getting are treatments that have really been tested scientifically to see that they work. And so referring back to the US Department of Veterans Affairs again here, they had a working group on management of post-traumatic stress disorder. And in 2017, they came up with some recommendations about best types of evidence-based psychotherapies for PTSD. And so one of the things that they noted is that these evidence-based therapies tend to be very individual, although some can be offered in groups quite effectively. But in general, we typically see these things in individual treatment. They're often manualized. So there's a very specific manual that you will go through with your clinician, or the clinician themselves will have a manual that kind of works step by step through the process of working through PTSD. And that's because it's been very well studied, and there are certain things that we know kind of need to be covered. And so that's why it's often created in manual form, so that as a way to check that all these things are getting covered. So individual, manualized, trauma-focused therapies, and they have a primary component of exposure and or cognitive restructuring, which helps to facilitate the processing of traumatic experiences. So let me just talk a little bit about that. Exposure, which you may have a little bit of idea about in terms of dealing with anxiety. For example, if you think about, how do you help somebody who is afraid of dogs to get more comfortable with dogs? Well, it's not about keeping them away from dogs forever. If you want to get more comfortable with dogs, you have to slowly, gently introduce yourself to dogs in a safe way. As just one example. Same kind of thing with PTSD. Fortunately or unfortunately, one of the ways to deal with your traumatic experience is to expose yourself to the memories of that experience. As difficult as they are, your brain kind of needs to go back and do some thinking about it, and to learn that you will be okay even if you think about this traumatic event. And in fact, the more that you think about it in a very purposeful way through therapy, the better you'll feel over time, and the less it will bother you, which is different than just having random thoughts about the trauma popping into your head and then pushing them aside. There's a very purposeful way that we do the exposure in therapy. And then the second part they mention here is the cognitive restructuring, which is looking at how you think and how your thinking has kind of gotten changed as a result of the trauma, and helping you to find out maybe if your thinking has gotten too extreme in some ways. So for example, before a trauma, many people sort of have this sense that that'll never happen to me. I'm perfectly safe, nothing bad will ever happen to me. And then something horrible and traumatic happens, and we tend to go all the way over in the other direction. Danger is everywhere. I can't go anywhere without something bad happening to me. And so neither extreme is ideal. What we want is something in the middle. No, we're not safe in all experiences everywhere, but we're also not in danger in all experiences everywhere. What's the happy medium? That there are some dangerous places, but I'm safe in most of the places I go, for example. So this is a list that the Veterans Affairs in the US has come up with for psychotherapies that they have reviewed that have a strong evidence base. And so there's about 8 or so things on this list. You'll notice the first 4 I have stars beside, and that's because they are trauma treatments that we offer at the Operational Stress Injury Clinic here at Deer Lodge Center, where we work with Canadian military and veterans of the military and the RCMP. Because Veterans Affairs only funds treatments that have evidence that they work. But these ones are also efficacious therapies. And I'd also like to talk to you a little bit more about these first 4 therapies by showing you some videos that introduce you to the therapies. So let's start with cognitive processing therapy for PTSD.
A traumatic event can change the way you think about yourself and the world. You might think you're to blame for what happened, or believe you don't deserve to be happy. You may start to believe the world is unsafe. Doing things like going to a grocery store or restaurant may seem too dangerous. These kinds of thoughts are common in people with post-traumatic stress disorder, or PTSD. They're called stuck points. They keep you stuck in your PTSD and cause you to miss out on the people, places, or activities you used to enjoy. So how do you get unstuck? Cognitive processing therapy, or CPT, is a PTSD treatment that can help you break the negative thinking that's holding you back. It's based on the idea that our thoughts affect how we feel and how we act. In CPT, you and your therapist will talk about how your negative thoughts about the trauma, those stuck points, have changed you, how safe and in control you feel, how much you trust yourself and others, and even your sense of self-worth. You'll practice a strategy to change or challenge your stuck points. PTSD can make you jump to negative conclusions, but there may be other ways to think about things that are more accurate and less upsetting. Imagine you're driving down the highway and someone swerves in front of you. You might blow up the driver. What a jerk. But what if he was racing to the hospital or having a panic attack and rushing to get off the road? If you consider these possibilities, you might not feel as angry. The bottom line, small changes in thinking can have a big impact on how you feel. Some people find that writing about their trauma helps them change upsetting thoughts and feelings. You and your therapist can decide whether or not this is right for you. CPT works just as well either way. You can also choose to meet with your therapist one-on-one or in a group with others who have PTSD. CPT is evidence-based, meaning it's been shown to work in multiple research studies, and it doesn't take years. In fact, CPT usually takes about 3 months of weekly visits. CPT can help you get unstuck, freeing you up to start enjoying the things you've been missing out on. Men and women, veterans and civilians can all benefit from CPT. If cognitive processing therapy sounds like it could be right for you, talk to your doctor about finding a CPT provider or visit the National Center for PTSD.
Okay, I'll stop with the commercial at the end there. And let's move on to prolonged exposure, which is another evidence-based treatment for PTSD. One of the things I often suggest to people is see if you can notice what some of the similarities and differences are between these different treatment approaches. So here's prolonged exposure.
If you have post-traumatic stress disorder or PTSD, it's common to feel like there are places or situations that are unsafe. It may seem like the best option is to avoid them, staying away from people or places that feel dangerous or reminders of a traumatic event. As a result, you may develop I can't rules. I can't leave the house at night. I can't trust anyone. I can't handle crowds. But these rules won't help you overcome PTSD. So how do you learn to say I can? Prolonged exposure, or PE, is a treatment for PTSD that helps you do safe things you've been avoiding. In PE, you and your therapist will practice exposure, meaning you'll work to approach things you've steered clear of since the event. You have to challenge your I can't rules to prove to yourself that you can. Remember when you were learning to swim or even drive a car? It was challenging at first, but got easier with practice. Exposure gets easier with time. With your therapist, you'll take steps to do the things that have been hard for you at your own pace. So if you're avoiding the grocery store, you might start by going when it isn't crowded, maybe bringing a family member along. You'll eventually practice going on your own, perhaps even during peak hours. With practice, you'll find that you can handle it. You'll also talk through the details of your traumatic event in a safe, gradual way with your therapist. Closing your eyes can help you concentrate. Retelling the event may sound like the last thing you want to do, but it helps with emotions like anger, guilt, and sadness. You'll listen to a recorded version at home too. After a few months, you'll find that you can talk about your trauma without feeling so overwhelmed. Prolonged exposure doesn't erase your trauma, but it can help you keep your traumatic experience from getting in the way of living your life. PE doesn't require you to take any medications. With your therapist's help, you'll follow a step-by-step program for about 3 months. Most people who complete PE show noticeable improvement in their symptoms, and many no longer have PTSD. Prolonged exposure works well for both men and women, and it's evidence-based, which means PE has been proven to work in multiple research studies. If prolonged exposure sounds like it could be...
Okay, so let's move on to another treatment called eye movement desensitization and reprocessing, or EMDR, for PTSD.
If you have post-traumatic stress disorder, or kinds of things in everyday life can trigger a traumatic memory and create stress. Specific places, loud noises, large crowds, even everyday things at your home. The thoughts, feelings, and physical sensations you had during your trauma can affect how you feel, act, and think today. So how do you reduce the stress caused by these memories? One form of talk therapy that has proven effective for treating PTSD is eye movement desensitization and reprocessing, or EMDR. Memories can be made up of many images and related feelings, and EMDR helps you reprocess the trauma to experience it in a different way. EMDR starts with history taking. This involves describing important life events and the trauma you want to work on, as well as your treatment goals. You'll learn ways to manage your anxiety too. Your therapist will ask you to look back at the trauma and think, what negative thought about yourself do you have from that experience? What would you like to believe about yourself going forward? How bad does it feel to you right now? You'll start processing a memory from there. Your therapist will have you move your eyes back and forth while you think about the trauma and those related feelings. During this phase, new and useful information comes up, and old, painful thoughts, memories, and feelings fade and become less distressing. At the end of processing, you'll look back at the positive beliefs that you want to have about yourself. Processing is over when these positive beliefs feel true to you and there are no unpleasant sensations in your body. This phase of treatment may take several sessions. You may also work through more than one traumatic memory before treatment is over. EMDR doesn't require you to take medication. With your therapist's help, you'll follow a step-by-step program for about 3 months. Most people who've completed EMDR show noticeable improvement in their symptoms, and many no longer have PTSD. EMDR works well for both men and women, and it's evidence-based, which means...
Okay, we'll move on in the interest of time. They all kind of end with that same little spiel. Last one I want to look at is written exposure therapy. And this one is kind of the newest of the treatments that have evidence, but it's been studied against some of these other ones and shown to be equally effective. But it has the advantage that it's a little bit faster than the other ones. So it's been kind of my go-to for the last couple of years, because if you can make the same changes in a faster amount of time, why not get better faster? So here's a little bit about that, and then we'll have questions at the end.
Post-traumatic stress disorder, or PTSD, is a heavy weight to carry on your own. For some, PTSD makes it hard to form close connections. For others, it may be negative thoughts or anxiety about activities they used to enjoy because of sounds or smells that trigger memories of the past trauma. No matter how heavy the burden, there are PTSD treatments that work. You have options. Written exposure therapy, or WET, is one of several effective talk therapies for PTSD. This cognitive behavioral treatment focuses on decreasing symptoms of PTSD through writing about your trauma and briefly reviewing the experience of writing your trauma with a therapist. This is more than just journaling. Research shows that writing and talking about traumatic events with a trained therapist helps people process trauma. No one will critique your style, grammar, or spelling. You just need to be willing to write about your experience. Conversations with your therapist will guide you through the process in the office or over a video session using telehealth. When you leave each session, there's no homework. You'll reflect on the session, but only write during your appointments. Most people meet with their therapist for about 5 sessions, and then they receive a certificate of completion. Written exposure therapy clients usually continue to see improvements in their symptoms and functioning and get back to enjoying life even after these sessions end. In time, you'll reconnect with others and get back to doing things you enjoy, like fishing with friends. If PTSD is weighing you down, ask your provider if written exposure therapy is right for you.
Okay, so we'll leave it at that. So thank you for listening. And now it's my turn to hear from you. Do you have questions, comments, or feedback for me?
Thank you so much, Dr. Pamela Holens. That was very informative. We do have a couple questions that came in throughout the presentation.
Okay.
So I will go through those and I'll allow you to answer them. So the first one is from Brenda. Who can diagnose PTSD?
Right. Okay. So officially, who can diagnose PTSD would be a medical doctor, a psychiatrist who falls under the heading of medical doctor, but specializes in mental health. So they're even somewhat better to diagnose this, and a psychologist like myself. Yeah.
Perfect. We have another question from Coralie. It says flashbacks ?
Oh, yes. I didn't mention that when I was going through the re-experiencing symptoms. But yeah, flashbacks are one of the ones that happen. So it's a little bit more. Was it just flashbacks ? Or did I interrupt you?
Yeah, no, that was it.
Okay. Yes. Okay. Yeah. So having memories pop into your head is a type of re-experiencing, and we call that just intrusive memories. But a flashback is more severe, more involved. It's in essence feeling like the trauma is happening again, and almost losing a sense of where you are right now. So it truly feels like the trauma is happening again, and you sort of lose touch with the present moment while that's happening. That's what a flashback is like. Yeah.
Then we have one from Susan. I think she was referring to when you were going over, you said about the cat. Losing a cat isn't a traumatic experience.
Yeah.
So you said, so losing someone close to you would not classify as traumatic.
Yeah, unfortunately, most of the times fortunately or unfortunately, who wants to be diagnosed with PTSD? I'm maybe not using the right words, but I guess we tend to throw around the term trauma and PTSD a little bit too loosely sometimes. And so sometimes, yeah, well, grandma died, I'm traumatized by that. Typically, that wouldn't qualify. However, if you watched grandma die and the death was really horrific in some way, then that would sort of meet the criteria for the type of trauma that would give you that check mark under the official PTSD criteria.
I guess you could say it depends, right, on the situation.
Yeah, like many things, it depends. And that's why you have to have a mental health professional who, is certified to make a diagnosis to do that, because it is easy to just kind of throw around words like trauma and PTSD.
Okay, we have one from Liz here. Can a clinical psychologist who is trained in doing assessments do an assessment for a trauma diagnosis or PTSD diagnosis, or are these assessments only offered from a trained psychiatrist?
Yeah, no, clinical psychologists, if they're appropriately trained, should be able to diagnose PTSD and trauma. Yeah, absolutely.
Perfect. Kate, we have a question from Sandra here. I'm not even going to try to pronounce that word. Will the use of MDMA, DMT for PTSD be addressed?
Oh, well, it's a growing area. It's not something that is being used yet at the clinics where I work. We tend to wait until there's really solid evidence for things before we introduce them. But yeah, it's definitely a growing area, and more people are looking into it, and we're hearing some reports that it can be very beneficial. So, come back to a talk maybe 5 years from now, and that might be one of the treatments I'm talking about. Yeah,
for sure. Okay, we have a question from Jen here. I will remind everyone, if you could try to ask your questions in the question and answer box, it just makes it a bit easier. They don't get all mixed up. So is PTSD similar in children, and what is the difference between PTSD and CPSD?
Okay. Is it similar in children? Yeah. So I don't specialize in working with children, so I don't want to talk outside of my expertise area. But what I can tell you is that there's not an awful lot of difference from what I understand. I mean, obviously, everything looks a little different when it manifests in children, and children can't always tell you in as clear words what's going on, but the general symptoms tend to be pretty much the same. CPTSD is another category. Complex PTSD is, I think, what the person is getting at, and that's it's not in our official DSM-5 book yet, but it's certainly talked about a lot in professional circles, and it tends to be what people are referring to when they're talking about childhood trauma, and particularly people who have had extensive childhood trauma. So not just one incident, not just like a fire in their house, but maybe they were abused on an ongoing basis. And that typically is what people are talking about with complex PTSD.
Okay, we have a couple more here. Valerie asks, can you do EMDR or WET on your own if your counselor isn't trained?
That's a good question. Well, so can you do it on your own? So you're kind of, I mean, yes and no. Okay. I would recommend, if you need PTSD treatment, find a professional who is trained to provide that treatment. You may or may not remember in the video on WET, they said that, this writing is different than just sort of writing in a journal. So it's a very specific protocol. There are very specific instructions for what to write about each session, and there are specific things that the therapist is supposed to discuss with you about your writing. That being said, I have used it with a client who has multiple traumas and taught them about it and gone through it the first time with them, and then said, here are the writing prompts. If you would like to continue doing this on your own, I mean, and I didn't just volunteer that. The client said to me, could I do this on my own? If you gave me the writing prompts. And I said, yeah, absolutely. Now that you know how it works and what to do, yeah, go ahead. EMDR, well, yeah, again, it's complex. It's not just moving your eyes back and forth while you think about the trauma, which is kind of how it tends to get shrunk into a little box. But that being said, when I do EMDR with clients, I will say to them, feel free between sessions. If you want to practice doing some of this on your own, you now know what to do, how to bring up the memory, and how to, bilateral stimulation is what we use. So eye movements, that was sort of how it originated, moving the eyes back and forth. Bilateral meaning both sides. And it's about getting both sides of your brain engaged. So it's actually kind of hard to do by yourself, putting your eyes back and forth without something to follow. But you can tap back and forth like this, or you can do sounds back and forth. Anything that gets one side of your brain engaged and then the other back and forth while you're thinking about the trauma can help to process it. But again, I'm going to go back to my better to use a trained mental health professional, at least when you're starting to really understand how it works, and to be safe about doing it so you don't make things worse for yourself. Yeah,
for sure. Okay. Can intimate partner violence cause PTSD?
Yes, absolutely. Absolutely.
Okay.
I'm wondering, you know what, let me quickly put up a list of, these are some of the typical things. Can you see that on my screen?
Yeah.
Okay, so this is from a questionnaire that we sometimes use for people with PTSD. And these are some typical types of traumas that kind of qualify, if you want to use that word, for potential PTSD instigators.
Okay. I do have a couple more questions. I do just want to maybe clarify something. So you can have a traumatic incident that doesn't lead to PTSD.
Absolutely. Thank you for bringing that up. Yeah, and I had meant to say that earlier, but yeah, that was kind of what I was getting at with the fact that, you know, a large percentage of the population will experience traumatic things in their lives, but that doesn't mean they'll develop PTSD. In fact, it's a much smaller percentage of people that develop PTSD.
Yeah.
PTSD symptoms are pretty normal right after a trauma, but if they go away on their own within a month or so, then it's not PTSD. We don't even diagnose it unless you've had the symptoms at least a month.
Okay. We have a question about what if you lost a 20-year career due to COVID and separating from your partner? Both feel very traumatic. Do these classify as traumatic?
Yeah, probably it doesn't technically. However, one of the nice things about this book, you can see how thick it is. That's because they find ways to come up with official diagnoses for all kinds of stuff. So there is a category called other trauma and stressor related disorder. So if you have all of the symptoms that are, you know, in common with PTSD, but the type of thing you experience doesn't technically fit the criteria as a trauma, then we'd probably diagnose you with other trauma and stressor related disorder.
Okay, I think that answers Liz's question in the chat. Then we have one more question. I know we're running a little bit over, so we'll end with this question. What are your thoughts on TMS therapy for PTSD treatment?
Right. Okay. So I assume they're referring to transcranial magnetic stimulation. And so my thoughts on that. Well, again, it's sort of a new area that is just burgeoning. I think it has more evidence for other issues like depression. It is something that at the OSI clinic here, operational stress injury, for those who don't know what OSI stands for, we had connected with someone at the St. Boniface Hospital who provides that treatment because it looked like it had some potential, and they were doing a study to see if individuals with PTSD responded well to that type of treatment. I haven't heard anything thus far that's made me really wildly excited about it, but I do think it can be an alternative for people that have tried other treatments that haven't worked. That, you know, this might be something worth trying.
Okay, one more.
Okay, one more.
Then no more. Are you familiar with the ACE score or ACE score, adolescent childhood experience, and someone who has the score of 10?
Okay, yeah. Yeah, I've often heard ACE as adverse childhood experiences, but yeah. So a score of, no, to be quite honest, I'm not familiar with the actual scoring for that. Again, I tend to work with adults. Not that an adult can't have a experience from their childhood, but in the setting where I work, it's typically focusing on things from their work, you know, their military experiences and so forth. So it just hasn't been an area that I have really explored. So unfortunately, I can't tell you what a score of 10 means, but hopefully that's something you can Google and find out.
All right, well, that concludes our presentation for this evening. Thank you so much, Dr. Pamela Holens, for being here and for presenting us with so much information and resources on post-traumatic stress disorder. So thank you very much.
Thank you. Thanks everyone for being here. Have a good night.
Good night.